on expert talk on management of MASLD and MASH. Our aim is to provide top educational content and awareness about MASLD and MASH. So today we are honored to have Dr. Kumarjit Dutta, renowned doctor from Kuch Behar, as a guest speaker. Sir is known to provide exceptional care to his patients, and we are grateful for his dedication to improving liver health. So without further delay, I would like to invite Dr. Kumarjit to share his valuable insight on MASLD. Over to you, sir.
Good morning. Thank you. Uh, Thank you for your kind introduction. It's my pleasure that Zydus Pharmaceutical has provided an excellent platform for this public awareness program. So today we'll be talking regarding the fatty liver disease, MASLD. Uh, Actually, a silent pandemic is going on regarding this fatty liver disease, which is very much talked about topic these days. So, as we know, next slide, please. Next slide, please. Yeah, as we know that a liver is the second most large organ in the body, and it weighs about 1,500 gram, and its fat content is less than 5%, with 5%, and it's located in right hypochondrium of the right upper abdomen, and it's pinkish in color. Next. Now we are coming to the function of the liver. As we know, liver is an important. Next slide, please. Liver is an important reticuloendothelial system. It destroys RBCs. It's a lot of work. It's done. The metabolic processes like gluconeogenesis, glycogenolysis, etc. And it produces bile as well as the proteins, which regulates blood composition, and it produces cholesterol and breaks down alcohol and its metabolites and detox the blood. And now we are going to have an idea regarding the fatty liver disease. Fatty liver disease is called MASLD, that is metabolic dysfunction associated with steatotic liver disease. Next slide. Actually, when the fat content of the liver increases more than 5%, it's called MASLD, and it progresses into MASH. MASH is a more severe form of MASLD, characterized by inflammation and liver injury, in addition to the fat buildup. And there are several risk factors like dyslipidemia, diabetes mellitus, and hypercholesterolemia, etc., and along with the obesity. Next slide. Now, the crucial thing is prevalence of MASLD. It's astonishing that 25% of normal population, regarding of its of their actual body weight, is affected with MASLD, fatty liver disease, and in case of diabetes, it's goes up to 60%, and in case of obese patient, obese population, 9 out of 10, that is 90%, are affected with fatty liver disease invariably. And there is a male gender that has a genetic propensity to get affected with MASH and fibrosis. Next slide. In the schematic diagram, here you can see the progression of MASLD. Next slide. The healthy liver is pinkish, soft in consistency, and then when the fat content is accumulated around the liver, it is called fatty liver disease, and it progresses towards the liver fibrosis, where the there is scarring, and we can find scar tissues over the liver, and the liver injury occurs. That means the liver tissue secretes liver enzymes, it gets into the blood, and finally it goes towards the cirrhosis of liver when the function of the liver gets deranged. Next slide. Now we need to know what is the difference between MASH or NASH. NASH, it is non-alcoholic uh, uh, steatohepatitis, and steatosis is the fatty liver disease, that a fat accumulation that is more than 5%. And MASH, there is fibrosis, and along with it, uh, there is derangement of liver function. Scarring of the liver is on benign stage is known as the fibrosis. Next slide. Now we are coming to the causes of MASLD. I should tell you that it's a lifestyle disease. Actually, physical inactivity, sedentary lifestyle, and the consumption of food that is more with simple sugar, simple carbohydrates, refined oil, fatty food, all these causes the accumulation of fat in the liver, as well as the obesity is a risk factor there, and there is a genetic predisposition over there. Some medicine, exposure to some medicine like corticosteroids have a risk factor, and the other metabolic syndromes are also the causes of MASLD. Now, obesity is the key thing where you can find MASLD very commonly. And then in case of obese patients, obese individuals, we get to see that the fat content of the liver is higher than 5%. It goes to 10%. And as I said, that it goes to MASH or NASH. Well, next slide. There is two things, diabetes mellitus and MASLD. These are interconnected, as the diabetic patients have threefold increased risk of death due to cirrhosis and increased risk of MASH, as well as the people with MASH have a high prevalence of diabetes, and as well as 2 to 4-fold increased risk of developing diabetes. Now coming to the symptoms. In our OPD or chamber, we can find patients with mild abdominal pain, lack of energy, anorexia, nausea, and even jaundice. Some patient also complain of weight loss. There is redness in the palms or cheeks, and due to enlarged blood vessels. There is enlargement of spleen also, as the RBCs are destroyed, and in the extreme cases, we can find the confusion where the encephalopathy takes place. Now coming to the next slide. Now coming to the diagnosis of the MASLD. Next slide, please. Next slide. There is in the diagnosis, it's very easier to find the association of MASLD fatty liver disease, where we can, in liver function disease, particularly SGPT, SGOT, liver enzymes, we can detect or we can have a suspicion of fatty liver disease. Then we can go for ultrasound or fibroscan. These are all non-invasive, and as well as CT scan, MRI, X-ray. But there are also invasive procedure, liver biopsy, and histopathology that can actually give the clinching evidence for fatty liver disease. Next slide. The most common blood tests are SGPT, SGOT, though it's not pathognomonic. It's not pathognomonic, as we can see the association of MSLD with the higher value of SGOT, SGPT, and rising value of SGPT, SGOT, but it's not pathognomonic because a lot of patients with fatty liver disease may have the normal SGOT, SGPT level. So we should go for some score system. Next slide, please. Score system like FIB-4 or NFLD fibrosis score. These are very simple procedures, and online tools are available for this scoring. And from these scores, we can easily predict the future of the patients in terms of fatty liver disease and its progression. Next slide. Yeah. Now coming to the non-invasive diagnosis of MSLD. In many patients, we can find fatty liver disease incidentally. Patients come with the reports, and they are very concerned regarding that fatty liver. Sir, we have fatty liver. Doctor, we have fatty liver. But the degree of fatty liver is very important. If the gradation, if it is grade 1, it's not that matter of concern because it's benign, but there should be lifestyle modification to prevent it. Ultrasound is very easily available, economic, and most accidental diagnosis can be done with the ultrasound, but there is cons also. It only detects the MSLD when the fat content is more than 25%. Below that, it may not detect, and it cannot differentiate between fat and fibrosis. So for the fibrosis, we need to go for fibroscan. And the fibroscan actually detects and differentiates fibrosis with the fatty liver disease. And there is some misinterpretation in obese patient also, but the fibroscan actually works on the principle of transient elastography. It has two values, and one is liver stiffness and another is controlled attenuation parameter, CFP. Liver stiffness actually indicates the degree of fibrosis in the liver, but controlled attenuation parameter actually indicates the degree of steatosis or fat accumulation in the liver. Next slide. Non-invasive diagnosis of MSLD can be done in outdoor basis, but the gold standard is MRI PDFF. What is MRI PDFF? It is magnetic resonance imaging proton density fraction. It's a non-invasive imaging technique used to measure or quantify the amount of fat in the liver, providing the quantitative assessment of the liver fat content. Well, but it's not widely available and it's costly. So a fibroscan and ultrasound in combination with the liver function report, that is SGPT and SGOT level, can give you more or less good prediction for the condition of the liver. And there is invasive diagnosis, that is liver biopsy and the histopathology. It's gold standard method for diagnosis MSLD, and it's the only way to actually diagnose the NASH or NASH, NASH or MASH, and it rules out the other liver diseases as well. But it's painful and there is individual dependent, because without patient consent, we cannot go for any invasive procedure, and it's not working in OPD basis. So there is also chances of misdiagnosis in early diseases as well. Now, coming to the progression of the fatty liver disease or MASH. Now, fatty liver disease in terms of steatosis, that is called MASLD, it's actually benign stage. Majority of the patients goes for isolated fatty liver disease, fatty liver with mild inflammation, and there is no actual difference in terms of death, but the fewer, one-fourth of the patients, 20 to 25%, has a increased risk of with the general population in terms of cardiovascular malignancy and liver-related disorder when it progressed to MASH level. And from the MASH, it goes towards the cirrhosis, and maybe then it can, over the years, for 7 to 10%, it could go to 6 point hepatocellular carcinoma, and rather another 7 to 10%, few cases for decompensation, decompensated chronic liver disease, where the liver function is severely impaired, leading to the development of complications like ascites, jaundice, bleeding, and encephalopathy as well. So we need to check the progression of this fatty liver disease in steatosis and MASLD benign level only. So we need to act before it's too late. Next slide. And as I have said, it's a lifestyle disease. Change the slide, please. Now coming to the treatment part. And treatment part, so we need lifestyle modification. Lifestyle modification in terms of diet and exercise. So diet and exercise is very essential, as well as lifestyle modification to cut down the alcohol level, or better to stop alcohol intake and smoking as well. And there are further newer medication which can actually reverse the MASLD if the diet and exercise is done, and control. If you can control your weight gain, you have to reduce your weight if you want to go for reverse the stages. Combination of hypocaloric diet and moderate intensity exercise provide the best likelihood of sustained weight loss. 3 to 5% can actually improve the steatosis, and progression is also towards the normal level. But weight loss effect on MASLD. Previous slide, please. Previous slide, please. If you lose weight more than 3%, more than equal to 3%, the fat content decreases. And if the weight loss is more than 5%, the inflammation also can be reduced. And resolution of NASH, if the weight can be controlled over the 7%, and fibrosis may be altered in somewhat if weight loss is more than 10%. So reduce the body weight is the key thing. It's instrumental in the treatment of MASLD. So every patient should be encouraged for exercise and diet for weight loss. Next slide. So the people affected with these MASLD, fatty liver disease, should consult a clinical dietitian for the diet. Mediterranean diet is indicated, and patient should be counseled. The Mediterranean diet, the term is very catchy and ornamental, but we need to focus towards the diet which is high fiber. Cut down your sugar level, no simple sugar, uh, no simple carbohydrate. Always go for whole grain and moderate uh, portion of protein intake. And you must not go for red meat. It's very less often you can take red meat or sweet. So hypocaloric diet should be maintained, and the calorie count is important when uh, the diet therapy is concerned. Now, type of exercise. Actually, the sedentary lifestyle is a very risk factor, is a very important risk factor for fatty liver disease. So, a person accustomed or habituated with the sedentary life cannot do a vigorous exercise very soon. So it should be started with simple exercises, simple aerobic exercises to reduce the fat level in the liver and maintains healthy weight. So you can go for uh, brisk walking. Brisk walking is you need to maintain the speed where you are somewhat out of breath, you cannot talk, uh, you will be sweating, and the people around you can easily identify you that you are exercising, you are walking, not just walking around without any purpose, but you are doing the exercise. This is the key thing. So start with the brisk walking 40 minutes per day, at least 5 days a week, and then go for resistance exercise. You can do it alternative day. Resistance exercise actually reduce the liver inflammation, improves the absorption and insulin sensitivity. The fatty liver disease and uh, diabetes goes together. Actually, there is a uh, pathology in insulin sensitivity. So insulin sensitizer is important in terms of treatment protocol. So exercise is also reduce the fat content as well as is increases your insulin sensitivity and its function. So next slide, please. Lifestyle tips to tackle the MASLD. As I have already said that it's a lifestyle disease, so lifestyle modification is the key thing. Lower your sugar intake, develop exercise routine, and stick to it. It's very important. It's not only doing the sometime as your wish. It's not that. You have to have a routine. Get enough sleep, get enough vitamins and minerals, particularly vitamin E, regular medical checkup, and eat small, and your duration between the meals should be small, should be not so lengthy, not so long. Now, pharmacological approach. Next slide, please. In pharmacological approach, we have two different molecule, that is vitamin E and pioglitazone. Vitamin E should be taken 400 milligram twice daily for at least 1 to 2 years. And pioglitazone is another insulin sensitizer that is indicated in NASH with or without fibrosis in both diabetic and non-diabetic patients. So pioglitazone should be taken 30 milligram, 30 to 45 milligram daily for at least 48 weeks, that is around 1 year, but it should be ideally taken for a minimum period of 2 years. Now, another molecule, saroglitazar, actually have shown significant promise in order to treat NASH with or without fibrosis. It should be taken 4 milligram daily, particularly before your first meal of the day, and it should be continued for 1 year long. and that will show the significant resolution of NASH. And it should be taken, and all this medication is indicated along with your lifestyle modification, your exercise, your diet, cut down your sugar level, your simple sugar level, and your other modifications. So, next slide. Uh, Tips to prevent fatty liver disease. So everything is in the slide is already explained. Quit smoking, exercise regularly, limit or avoid alcohol. For our part of the world, alcohol is very dangerous in terms of fatty liver disease. Though it is non-alcoholic fatty liver disease, but it's a lifestyle modification. If you increase your alcohol intake, then you go for quitting, go for smoking, and you will you have the laziness. You can't follow your exercise uh, routine, and you will eat anything. So the fat refined sugar should be cut down, and you increase the high fiber diet with lots of fruits, vegetables, salads, uh, all these things, and definitely maintain weight. So uh, thank you for your attention. Now I am open for taking any questions if you have.
Yes, thank you so much, sir. So, sir, we will move towards the question answer part.
Yeah,
So question we received is, sir, what is the ideal diet recommendation for MSLD patient?
diet. Hello, what is the ideal diet recommendation? Uh, in diet, I have already told you that it should be
Yes,
high fiber diet, low salt, low uh, sugar, simple sugar, and we should eat the whole grain, um, brown bread, uh, uh, lots of fruits, whole fruits, not the fruit juice, whole fruits and vegetables. Mm, Mediterranean diet should be followed. Protein should be taken in moderate amount, and cut down your red meat, all these things, and don't go for junk foods or
yes, sir.
fast foods.
Okay, sir. Sir, what kind of exercise will you recommend for MSLD patient?
Yeah, I will recommend both the uh, aerobics and resistance exercise as well. Start with the aerobics. Start with walking, a morning walk with which is brisk in terms of the speed. So you can out of breath. You cannot talk. You will be sweating, and the other people around you they can easily understand that you are working for an exercise. So there, the actually the mm, idea is to reduce your calorie expenditure, reduce intake of calorie, and uh, increase your calorie expenditure. And with this, you can start with uh, resistance exercise. You can with low weight, but you should stick to the protocol that your every muscles of the body is working is for this resistance exercise. So you can do it in alternate day, or reduce the time of aerobics exercise to 40 to 30 to 40 minutes, and then you can do some resistance exercise, not the for the whole body every day. You can do it in a week. You can do a chart. a routine. So and follow and stick to it.
So,
Any more question you
thank you
would
so
like
much,
to
sir.
ask?
Now,
Okay.
extending and engaging talk on, and please stay.
Okay. Thank you. I think there is another internet problem. Uh,
Hello.
yeah, yeah,
Ye- Yes, sir, we are
yeah, yeah.
done.
Hello.
Yeah, thank you so much, sir. It was really
Yes, sir,
very
we are
nice
done.
show. Yeah, very
Okay.
nice
Please
show.
stay.
And yes, sir.
Okay.
Thank you so
Can I
much.
go
Thank you
off?
so much.
Okay. Thank you.
Yes, sir. Thank
Yeah.
you. Thank
Hmm.
you. Have a good day, sir.
Ha. Same to you. Thank you.